So can you tell us a little bit more about why mobilizing your scar is important?
Yeah, so scar mobilization is important because it can help to desensitize the tissue. And so with that, with the cesarean, we're cutting through 7 layers of tissue. And so with all those layers of tissue, we have lots of nerves, and so they can become really sensitive as one, you've just gone through some controlled changes to the body, but then you're going through this healing process, and so those nerves are regenerating. We can get that pain, that tingling, that numbness, especially if we have infections or maybe some increased like binding or something that forms. So working to desensitize that tissue can help to reduce that pain, reduce some of that sensitivity that you're feeling, and can reduce anything like if you're having issues donning or putting on like clothes, maybe even just holding your baby and having that pressure there. It can help to improve blood flow, so it can help to heal a little bit quicker, help with that inflammatory process, as well as that remodeling of those collagen tissues. And so what happens if we, or as those tissues start to heal, they'll start to kind of just bind and connect into like these disorganized webs. And so as we kind of work through and mobilize and ease into some movement, that can really help with a smoother layer of binding and can help reduce some of that like shelving or like that bulging
appearance
of that scar and of that area around it. Along with that, then it can help to reduce any discomfort you have and make it easier to move back into mobility, whether it's just walking around carrying your baby or easing back into the gym or back into work or doing your house chores.
So are there any creams, lotions, or oils that you would recommend for minimizing the scar appearance?
So with that, I actually haven't really found any creams or lotions or oils that will specifically do that. We do want to think about keeping that scar, just like any other scar, well hydrated and clean. So within that first few weeks, like we're not really putting lotion or fragrancy type lotions or oils or coconut oils on there, because we don't want to increase the risk of infection. But like as we move away from having any like redness or swelling or any open scabs or scabs in general, then we can start putting a little bit of light lotion on there. It won't aesthetically like necessarily be the big changer for that. We're looking more at moving a little bit more and getting that tissue moving. That will really help more with that appearance, as well as factoring our nutrition.
Right, great. I think that's it.
Awesome. I'm glad we actually talked about that.